How do I use my clinic time effectively?
I think it's really important for you to prepare for your doctor's appointment or your consultation with your myeloma specialist. They have a limited time in the clinic. It might be 20, 30 minutes to spend with you. And if you go in asking your doctors questions that you may be able to learn on your own that are maybe generic information about what is myeloma or what is an M spike, you're wasting that valuable time where you could be talking one-on-one about your disease and about your side effects and about ways that your disease can be monitored, or a treatment plan, what's your long-term goals, what's your strategy. So you don't want that focus to be on general information where you could get that information maybe through a support group, maybe through a webinar, maybe through Health Tree University like this video is part of. And you want to spend that time in the clinic talking about you and your specific situation.
So second opinions, consultations will vary both in terms of cost and preparation. Some consultations might ask you to retake your medical tests at their facility so that they have those lab results available within their systems. But today, more and more of those myeloma specialists are able to work with your local doctors and obtain your test results either from them or from you directly. Make sure you also prepare a list of questions to ask. These may be questions that you've already asked your local oncologist, and you just want to hear another response from a myeloma expert. They may answer the same way your local oncologist did, in which case you probably feel good about that. They may have a different opinion, in which case it's important to bring that back to your local oncologist and ask whether or not that second opinion should be considered. So I think it's always valuable if you have another person with you. That other person at a consultation will hear things that you don't necessarily hear. They may ask questions that you don't think of that are important to get answers to. I think it's also good to bring a tape recorder. Back in the 90s, when I did this, I would always write my set of questions on a piece of paper, and I would write down the answers, and I tell the doctor, wait, don't look at the next question and answer it until I'm done writing the answer to my last question. So however you can get the information, whether it's pencil and paper, recorders, or another person being with you, I think all of that can be valuable.
You should write out your questions so that you don't forget them when you're in the doctor's office. It's a good idea to take a friend or a caregiver with you to your appointments. And it's also important even to record those interviews, those office appointments. If you don't understand something, seek clarification. And it's quite possible that your caregiver or your friend who accompanies you will help remember some of the things that you forget when you're at your appointment.
What questions should I ask my doctor?
I believe all patients should be actively engaged in their care, and to be able to do that, you need to be informed. And the best way to be informed to begin with is to ask your doctors questions. And I think if you're newly diagnosed or at any point of your care, there are certain things you need to know. First of all, you need to know what type of myeloma do you have? How's your disease going to be measured? Do you have any risk factors that's going to make your disease easier or harder to treat? So I think those are questions you want to know. What type of myeloma I have? How are you going to be monitoring my response? And where do I fit genetically? Did I have genetic testing done? If I did, what kind of genetic testing? Then I think other questions you should ask your doctor are, what are the available treatments for me? And what are the risks and benefits of all those treatments? And what side effects would they have? Another question that I think that probably as a newly diagnosed patient you might not think of, but you might also want to ask, are there any clinical trials that I should be considering? Because sometimes clinical trials may be your best option. And just because you're considering a clinical trial doesn't mean the drug was not approved for another stage of myeloma. So you might be getting a very active drug up front where you might not have access to that drug outside of the clinical trial.
And as you learn more about this disease, you might ask that myeloma specialist, what about clinical trials? They may not be available through your local doctors, but they may be available at a facility where you're getting that second opinion. Or bottom line, you might just ask that doctor, hey doc, what questions should I be asking you?
Well, I think the most important thing that you want to, if you already have some data, you want to be able to take that data with you. I think also if you want to make sure that they're doing testing for fish, for gene expression profiling, and you want to make sure that you have a baseline based on that information. You want all the standard tests as well, so you want to make sure that they are done. And you also want to know whether or not they do MRD testing as you're going along to determine how your treatment is progressing. I think that's quite important as well. So if they don't answer those questions to your satisfaction, then maybe it's another myeloma specialist that you want to talk to, one that's further along in their education process as to what the best way of controlling myeloma is.
For sure, you want to be talking to your doctor about any potential clinical trials, whether you're a newly diagnosed patient, whether you're going through transplant or on maintenance, whether you're relapsing. You definitely want to know whether there's any options outside of the currently FDA-approved options. I think it's always really important that you ask your doctor what they think about your cytogenetic risk. Make sure that you've had the appropriate tests done and that they're taking that into account when making treatment recommendations. And then I think it's also really important to talk to your doctor about, aside from clinical trial, all the options that are out there, and then how those various options might alter your quality of life. Because we now have so many different drugs and so many different combinations, we're thankfully not in the position where we were before, where once somebody relapsed, there was maybe one option and you just had to do it. Now with all of these new options, you really have to take into account the patient. You should have been anyways, but now we kind of have the luxury of doing that in terms of saying, well, you have to be honest with your doctor. If you really want an all-oral regimen, let them know that. They might tell you we have one, it's not in your best interest, but at least ask those questions. Ask about side effects and how that might impact you. Let them know that you are working or not working or working part-time and what works with your life. Let them know about important life events so that they can really tailor a treatment decision for you.